Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude is more of a moment of reflection. We want to dedicate it to the 500,000 Americans lost to COVID-19. These were parents, neighbors, and friends, and their loss continues to be felt by the loved ones they left behind. We especially want to honor the memory of the more than 500 Knox Countyans that we have lost in our community. Here at KCHD, we will work to honor their memory by doing everything we can to prevent the further loss of life due to this virus. This week, we continue to vaccinate every day. For first dose appointments, we are using our wait list to reach out to eligible individuals and schedule opportunities through the health department and our community partners. As of this morning, nearly 17,000 are on the wait list. If you're on the wait list but have already been vaccinated elsewhere, we ask that you please call our public information line at 215-5555 or 311 to let us know so we can take you off the wait list. We are grateful to the folks who've already done this, as it helps us work through the list faster. When it's your turn on the wait list, we will reach out to you via phone or text to schedule your appointment. The call will come from an unknown number, so please make sure you're answering the call. As a reminder, we will not ask you for your Social Security number or any banking information. So if someone calls asking for that information, it's a scam. As a reminder, this is a living list. So if you qualify based on the current phase requirements, you can visit the website at covid.knoxcountytn.gov and sign up. If you don't have access to a computer, you can call our public information line or 311, and one of the operators will help you sign up. Currently, we are vaccinating those who fall in the first three priority groups, such as healthcare workers, child care staff, and K through 12 teachers and staff, and those who are 65 and older. And that's a whole lot of people in our community. A full list of eligible groups can be found on our vaccination information webpage. As we have stated before, with the expanded eligibility groups this week, we have thousands of more people who can now receive vaccine. However, eligibility doesn't mean access. The demand for this vaccine continues to greatly outpace the supply. So we ask everyone to please be patient. There are other opportunities to receive first dose vaccines this week through other providers across the community. We are beginning to see more organizations such as pharmacy and medical providers that are coming on board to provide vaccinations, and that's exciting. So be on the lookout for those appointments. If you're able to take advantage of these opportunities, please do so. The state has rolled out a vaccine finder webpage that lets you find vaccination opportunities based on your location. We encourage you to look at this website to see opportunities near you. This page is also linked to our vaccination information page. Last night, County Commission voted to approve the use of a building on North Broadway for a vaccination site. This space will allow us to have more flexibility to schedule ongoing vaccination opportunities for our community. It's also a centralized location that provides good accessibility. As we mentioned last week, there are additional logistical steps that need to be taken to get this space ready. Once we have a better idea of when we can start utilizing the space, we will provide an update. For an updated look at vaccine numbers across the county, you can check out our vaccine information page. We will be updating data every Tuesday and Friday. On this page, you can see that nearly 85,000 vaccinations have been given in Knox County to Knox Countyans. Here at KCHD, we've administered 17,600 of those vaccinations. On this page, you can see how they're broken up into first and second doses, as well as viewing the demographic breakdown of vaccines administered across the county. And now we'll move on to the local COVID situation. We have 31 new confirmed cases since yesterday's report. We have 1,652 active cases. 56 Knox County residents are currently hospitalized, and sadly, we have 3 additional deaths to report today, raising our total to 528. And now I'll open it up for questions.
All right, the first question we have in is from Megan with WBLT. There are feelings among some individuals who are currently eligible for the vaccine after the Children's Hospital Vaccine Clinic for teachers that a large portion of those already on the wait list were skipped. What is the health department's message to those who've been waiting and feel like they were deprioritized?
Nobody's been deprioritized. Children's made a decision to work with Knox County Schools to help get teachers vaccinated, and they've done that. They are also vaccinating people in all of the other categories along with vaccinating teachers. And this is very similar to what we did for first responders. With what if you recall, we did closed pods for those folks, and they came and got vaccinated. And it's very similar to that. They're doing that for teachers to get those folks vaccinated so that we can keep our schools open.
From Allie with Knox News, what percentage of Knox County vaccine allocation has been administered?
Okay, it's a great question that I don't have the answer to off the top of my head, but we can look at that. There'll be, it might not be an exact number. We can give you an estimate of that.
From Grace with WBIR, how many doses on average is the Knox County Health Department receiving each week?
So we, the Knox County Health Department, are on average receiving around 1,000 to 2,000 doses, kind of in that, and that's a big range, more like 1,000 to 1,500 doses a week. And it's based on who all's asking for vaccine and who all needs vaccine, because we want to make sure those folks out in the community who want to vaccinate get vaccine to provide it to the community in different locations than we're able to.
Also from Grace with WBIR, how many doses on average is KCHD seeing the state send to Knox County providers each week, including the hospitals?
So as a county, we're receiving about a little over 5,000 to about 7,000 doses each week. And again, we're splitting that up among us, hospitals and pharmacies and some medical providers. So you think about our population, about 470,000 people or so, maybe a little less in Knox County. We're slowly making progress, but I'm actually pleased with our progress because in Knox County, we are at 11.86% of our population has had at least one dose of vaccine. And that compares to the state at 10.66% having at least one dose. So we're making progress, although be it slowly. I know everybody would like it to be faster, but trust me, we're getting vaccine out there and vaccine is being given as quickly as it can be.
From Megan with WBLT, will patients in Knox County ever have an opportunity to choose the brand of vaccine they prefer?
Maybe, I don't know. I mean, I guess I'm not sure. That's one of those things that we're not sure how that's going to roll out. That would require that we have enough of all of those vaccines for people to be able to choose. And I'm not sure when that'll happen.
From Austin with WATE, the deal to lease the Food City building was approved last night. In addition to monthly rent, how much more will the cost be to renovate / set up the new vaccination location, and how long will it take?
So the rent is $5,700 a month. There'll be some cost, and we can get that information to you. I don't have those numbers in my head. Actually, Food City is bearing some of the cost of getting things out of the way and cleaning up the space.
And also from Austin with WATE, do you have plans for how the vaccination location will look inside?
Our vaccination team has been out there and laid out a plan for how the flow will go. And we'll set it up and probably have to tweak it just based on size and space. And that's just kind of what we do. We tweak it to make it work better.
From Grace with WBIR, the state put teachers behind those 70 and older and in phases 1A1, 1A2. We're hearing from people who say opening a closed pod for educators immediately is letting them skip the line. What's your message to the 16,000 people who were on the wait list before teachers became eligible?
So those folks will get vaccinated. The state decided to move on to the teachers group, and we're following suit with the state. They are part of that 16,000 people that are on the, or 17,000 people on the wait list. Two, they can sign up, and they have signed up, we're sure. So it's a combination of things, and we are all vaccinating. So the way we see vaccinations is that it's a community effort. So we are actively vaccinating folks in the 65 and older and those other groups, as well as teachers. Some groups are focusing just on some groups of teachers, but they're also focusing on the 65 and older and other groups. So it's a group effort being done in various ways with closed pods and open pods. It's working. We're leading the state as far as the metro in the percent of people who've gotten their first dose of vaccine, at least one dose. So it's working, and we're getting people vaccinated. And yes, we all wish it would go faster. We all wish it would happen right away. Trust me that everybody involved in getting people vaccinated is very aware and cognizant of trying to be equitable and trying to get those older folks vaccinated as quickly as possible. And that's why they're doing a combination of things. They're not just doing one thing.
Grace with WBIR, among medical workers and first responders, what's your impression of vaccine uptake? Is it lower than you would like?
That's really not a number we're tracking. That's probably a better question for employers of healthcare workers and first responders, because they know within their employee population what the vaccination rates are probably.
From Megan with WVLT, some viewers have asked if there will be any more walk-in vaccine clinic opportunities. Probably not. Scheduling is working really well, and using the wait list, and then that I can come at any moment wait list. The what's it called? Standby.
The standby list. Sorry, the standby list is really working to make sure that we use all our doses of vaccine. People aren't having to wait as long. It's a little less chaotic. It's a little less risky as far as being able to spread out 6 feet. So it's really working to do that, and the appointment system is working and helps cut down on the wait and the lines.
Claire with WVOT, does Knox County Health Department decide how many vaccine doses local Walmart, Sam's Clubs, or other independent local pharmacies get, or is that coming from a separate pool?
So that's under the federal pharmacy partnership, and we don't have any say in how much they are being given. I think that's probably between the state and the federal government, but it's not something that we have any say in or any involvement in.
Yes, the independent pharmacies.
Right. She asked specifically about Walmart.
They added the second part was the independent.
Yeah,
Okay.
Walmart, Sam's Clubs, and other independent.
Oh,
local
sorry, my
pharmacies.
bad. Okay, I just heard Walmart. So that's all about Walmart. So the smaller pharmacies, we are helping the state with allocation. If you can imagine how many small pharmacies there are across the state, to have us be kind of the middleman and help allocate those doses. So those pharmacies that get activated request doses from us. We get the allocation amount from the state, and we try to divide it up based on, if they're using the vaccine they've already gotten, and how many doses they've asked for, and how many doses were allocated as a county, and trying to be equitable and trying to give it to as many places, and quite honestly, trying to give it to those places who we know are actively vaccinating.
From Grace with WBIR, while there are lists of people who have signed up for the vaccine and people calling in for appointments, how are the two groups being serviced? Is one taking precedence over the other, phone versus online?
So people are not calling in for appointments. They're calling in to sign up on the wait list. So they call in and sign up on the wait list. They get put on the wait list, in the next one in order. So you can go online and get on the wait list, or you can call in and get on the wait list. It's the same wait list. It's just that somebody else does the stuff on the computer for you if you call in. So it, takes as long to put you on the wait list as it would for you to enter your information yourself, probably. So it's a single wait list. So then what happens is we take that list and we either call or text those folks and say we have a vaccination opportunity, and they can then register to attend that opportunity.
From Austin with WATE, we're seeing numbers at a level we haven't seen since last year. Is this just coincidence, or could we see our coronavirus numbers continue to fall from here on out?
Well, I sure hope they continue to fall, but they won't continue to fall if we let up our guard and we stop practicing the 5 core actions. You've got to continue to practice the 5 core actions and get vaccinated when you can, or our numbers will go up. I guarantee that. So this is not the time to change direction. This is not the time to go, whoo, this is over. We still have disease in our community. And if you look at some of the research out there, we probably have more disease in our community than we can see by the number of positives. So please continue to practice the 5 core actions. That being said, these numbers are encouraging, and we hope they continue to go in that direction. We think it's a combination of folks getting vaccinated, folks practicing the 5 core actions, and then we have folks who have some natural immunity from having had COVID. We're not at herd immunity yet. We're not stopping transmission, and herd immunity would be accomplished when we have at least 50 to 70% of our population vaccinated with COVID, and we're obviously a long way from that.
From Grace with WBIR, is the wait list only for doses administered by KCHD? Are there any plans to use the wait list for clinics with KCHD partners? Why or why not?
So the wait list is kind of a community wait list. We are the primary users of the wait list. However, when you sign up, it tells you that we might share this information with another vaccinator so that they can reach out to you when they have opportunities, so that you would have access to that opportunity as well. So we really want to spread that around so that any opportunity that's out there, people have access to it. So it's a little of both, community partners plus us.
Any further questions? Please go ahead and submit them now. All right. Let's see. We have a question from Austin with WATE. Representative Jason Zachary is expected to present legislation at the state level, which would limit health board powers and give that power to county mayors. We saw a form of this locally. Is this the time to do this? Are we at a point when the Board of Health could step back?
I think the Board of Health is serving a very vital role at this time and will continue to do that. We, of course, will abide by any legislation that is passed at the state level, and the legislators will make those decisions based on the information they're provided and the information they have at their disposal, and we will comply with whatever that is. But I do believe the Board of Health is providing a very important role for our community. I believe they've done a really great job of balancing regulation with reality, in the short way to say it, and have been thoughtful about their decisions and will continue to provide guidance, and I hope that that will continue.
From Grace with WBIR, a follow-up on her previous question. She's asking, do you know what community partners are using the wait list?
I do not know off the top of my head, I'm sorry.
Hey, Grace, this is Charity Menifee in the background. A lot of the community partners have their own methods of registering people. And so basically, typically what it has been is if they have some slots they haven't filled, they will reach out to us for numbers or from information from the wait list, and we provide it. I don't have that off the top of my head, but that's really how it works primarily.
Yeah, it's not solely being used by other organizations as their primary way to schedule appointments, just when they need some assistance filling some slots. Any further questions? Please go ahead and submit them. From Claire with WUOT, asking about awaiting response to a public records or 2-week public records request for the exact number of vaccine the county has received and how many have been distributed to each community partner. Can you provide an explanation why this information has not been made public yet? And do you plan to publish data on the total number of vaccines allocated to Knox County and distributed to providers on KCHD's website? And I can help answer that, Claire. That is something that we are working. We've received quite a few public records requests recently, and we're working through those. And we are going to be getting a response back to everyone who's requested that information, hopefully by the end of today is what our plan was. All right, and Grace, yeah, same thing for your question as well. All right, any further questions? All right, I'm not seeing any further questions come in, so thank you all for your time, and we will see you again on Thursday.